5-minute eye medical lectures. Good day and welcome to our channel. We are glad you can join us. My name is Octavio, and I am this lecture eye-generated avatar. This is the second lecture in our series on Bruxism. Today's lecture reviews the up-to-date knowledge of the association of Bruxism with painful disorders of the jaw. This lecture was developed by Dr. Nicholas Scormetta, specialist in orofacial pain. As we reviewed on the first lecture of this series, bruxism is a motor activity involving the grinding, clenching, bracing, or thrusting of the jaw. It can be classified as sleep bruxism, which is characterized by rhythmic activity of the jaw muscles during sleep, or awake bruxism, which is characterized by sustained repetitive activity of the jaw during waking hours. Musculoskeletal signs and symptoms are often referred as temporomandibular disorders, TMD, which includes a group of conditions that affect the temporomandibular joint, the muscles that control jaw movement, and associated structures. These disorders can cause pain, tenderness, and dysfunction in the jaw, and can be associated with conditions such as headache, neck pain, and ear pain. The idea that bruxism can cause temporomandibular disorders, TMD, is still a matter of debate. And up to date, there is not enough evidence to support the idea that bruxism has a linear causative role in the development of these disorders. Several systematic reviews of the literature on bruxism have been conducted, but the results are conflicting and dependent on many variables. While there is some association between bruxism and musculoskeletal symptoms, the evidence is not conclusive. In fact, several studies have shown different results in the association between bruxism and TMD using different assessment methods. Instrumental assessment methods, such as electromyography, EMG, and polysomnography, PSG, can objectively measure bruxism and other variables, while clinical assessments rely only on self-report or clinical evaluation of symptoms and signs. Studies that have used instrumental assessments have found a weak or no significant association between bruxism and TMD. This is particularly true in studies that measured sleep bruxism instrumentally. Some studies that have measured awake bruxism with ecological momentary assessment or single-channel EMG have found awake bruxism may be associated to masticatory muscle pain. In contrast, studies using clinical assessment and self-report have reported a stronger association between bruxism and temporomandibular disorder, specifically masticatory muscle pain. However, it's important to note that self-report studies may overestimate the prevalence of bruxism. And overdiagnosis of bruxism may result in an overrepresentation of this association. Due to these inconclusive findings, particularly in the studies that used instrumental methods to assess bruxism, experts have suggested that the plausible link between bruxism and TMD may be that bruxism may act as a continuum. The summation of total motor activity over time may act lowering the threshold for having temporomandibular joint disorders and muscle pain, increasing the risk of developing TMD over time. However, further research is needed to fully understand the complex and multifaceted relationship between bruxism and temporomandibular disorders. In conclusion, while there may be some association between bruxism and painful disorders of the TMJ and muscles, the evidence is inconclusive, and further research is needed to fully understand this relationship. Clinicians should be cautious when diagnosing bruxism. It is important not to mistake bruxism for TMD and vice versa to manage these conditions appropriately and to improve patients' quality of life. If you enjoy our content and find it helpful, we would appreciate your support by subscribing to our channel. Your subscription will help our team of experts create more eye-powered medical content for dentists, healthcare professionals, and patients alike. Thank you for your support.